Reports of immigrants who are in the United States illegally being detained and deported are nothing new, but an obscure process known as medical repatriation has led to the deportation of hundreds of immigrants in recent years without involvement from any government agency. As CCTV's Nitza Soledad Perez found out, it's a system that has very little to do with enforcing immigration laws and everything to do with the hospital's bottom line.
Pedro Preciado and other undocumented immigrants run the risk of being deported while unconscious. Pedro, a 38-year-old from Colima, Mexico, became a paraplegic while in custody of the United States Immigration and Customs Enforcement Agency, better known as ICE.
Me detuvo migración.
Immigration stopped me, and they were going to deport me, and I had my accident.
Ahí es donde yo tuve mi accidente.
It happened at the Chrome Detention Center in Florida, a privately run facility contracted by ICE.
Estaba haciendo ejercicios.
I was exercising, and I fell.
Y me caí.
For a few years, the federal government provided for all his medical needs, and once he was better, attempted to deport him. John De Leon, Pedro's lawyer provided by the Mexican consulate, managed to stop his deportation at that time. Later, under the care of a nursing home, he suffered an infection and had to come back to the hospital. After he was stabilized, the entity that then threatened him with deportation was the hospital, not the federal government. The little-known practice is known formally as medical repatriation. It allows hospitals to put patients on chartered international flights even when they are unconscious.
The hospitals have taken it upon themselves to basically participate in private deportations.
A recent report published by immigrant advocacy groups concluded that at least 600 immigrants were involuntarily removed from hospitals this way during a 5-year period, and there could be many more. Under the Obama healthcare initiative, those in the country illegally do not have access to federal subsidies or insurance sold through the new state-based exchanges. In other words, zero health coverage, and the hospitals do not want to pick up the tabs.
It may cost $20,000 to send somebody back to their home country, but the savings could be in the hundreds of thousands or over $1 million for a hospital, depending on the type of care that they're providing the patient.
Is it legal under U.S. law to move these people without their consent?
No, obviously not. I mean, under U.S. law, the federal government requires that hospitals take patients in if they're in an emergency type of situation or need acute care. And the federal government also requires hospitals to provide for an adequate or appropriate aftercare treatment program for these folks.
But once a patient is stabilized, that funding ends, along with the requirements to provide care. In a written statement, ICE tells CCTV America that they're not involved with these hospital practices. It says, ICE plays no role in a healthcare provider's private transfer of a patient to his or her country of origin. These kinds of transfers are not the result of federal authority or action and are not removals, deportations, or voluntary departures as defined by the INA. As for the American Hospital Association, it says it does not have a policy governing immigrant removals and that each hospital handles these situations on a case-by-case basis. On those occasions when patients are moved to a different care setting, including being returned to his or her nation of origin, it is a decision made by the patient, the care team, and the family, when appropriate. But according to immigration advocates, some hospitals lie to the patient's relatives and tell them that these badly injured and unconscious individuals want to return home, causing many grief-stricken relatives to agree to a transfer. We located Pedro's sister, who lives almost 3 hours away from where Pedro is hospitalized. Rosalba Preciado says she lives in a constant fear that one day the U.S. hospital might get tired of him and send him back to Mexico.
What is he going to do there? He has no one. If I would have the means, I would take care of him. I would assume the responsibility. But we have no money to take care of ourselves and feed him. If I stop working, how are we going to survive?
As Pedro recovers under the constant threat of deportation, and despite his loss of mobility and loss of contact with his family in Mexico, there's one thing that still brings a smile to his face: the thought that he may, one day, walk again. Nitza Soledad Perez, CCTV, Miami.